Unfortunately, physicians are extremely dogmatic and don't want to hear anything about things that they haven't heard about. They don't want to learn anything. They've done their learning in medical school, and now they read their journals to keep up with whatever's passed on through the journals as godlike dogma. And they absolutely don't want to see if there's any alternative.
I know this because we didn't introduce you.
Because I'm a physician, that's why.
Okay.
The problem with strokes is that it's probably some of the worst abuse in terms of that dogma, because you learn since the first neuroanatomy class you ever had in medical school, the dogma was always nerve cells don't regenerate in any way, functionally or anatomically, and whatever damage is done to it is going to be forever. They expect when you have a stroke you're going to, sit in a corner and just be miserable. And any other alternative you present them with, as far as they're concerned, is BS. It's just hype.
So what Dr. Hammesfahr is doing
Is God's work as far as I'm concerned.
you had also said earlier that
And is very difficult to do in medicine. To go against the grain, you take a lot of abuse. Everyone's going to name call and abuse you in ways that, in terms of questioning your legitimacy as a physician and a scientist, because you don't have that double-blind study, which is essential in medicine, with placebos and controls. And obviously, in this kind of business, you can't have control patients where you're just not going to do anything for. That would be unethical. So you do need these kind of placebo and controlled studies. But in certain fields, case study is probably much more relevant. And something like this, the results speak for themselves. You have a person with a stroke 4 years later, you can't say that time just got them better. I mean, that's stretching. I haven't seen any dramatic changes in my condition. I mean, the easiest thing for me to tell in terms of improvement would be some response in my left upper extremity. I've seen enough positive results here with patients that I'd have to stretch it and be tremendously cynical and pessimistic to say I'm going to be the one that it's not going to work, that I'm going to go with the odds, which I usually try to stick with. And the odds are I'm going to get better because I'm not going to be the one in whatever, in a zillion that doesn't get better around here. And again, nothing succeeds like success. So, you see these results. It would be hard for me to imagine even the neurologist I deal with up north, if I just drag, them down here to see what goes on. It'd be very hard even for the most cynical, dogmatic physician to reject it if they see it firsthand.
What would you say to physicians, cynical physicians, or any physician out there that had a patient that was interested in this and called you and asked you for your advice?
No harm. If you can afford to do it, and if it fits into your social scale, problems you're dealing with, you have to be crazy not to try it. Because medicine, the Hippocratic Oath, is no harm. And it's clearly there's no harm. It's not like you're taking a toxic drug for a problem and it's going to harm you. So you have no choice but to do this, if you can afford to do it.
What do you think of the philosophy behind therapy?
Again, as a scientist and a physician, I was dealing with the same old dogmas in terms of, the brain doesn't heal itself. But the philosophy of cerebral vasodilation makes sense. You back into the concept that all the brain tissue isn't dead, that it's just been shocked into kind of sleeping, then increased blood flow to that area makes sense. And there are other therapies that do use the same concept, things like hyperbaric oxygen. So you back into the concept of that the tissue can't be dead if oxygen or increased blood flow seems to wake it up somewhat. It must be just, quiescent in some way.
Okay.
So.